All right, well, good morning, everybody. Today I'm going to talk about the role of a care navigator in developmental peds and kind of walk everybody through the journey to developmental peds for a family and why having a care navigator is so important for the families that we see and what we've been doing so far. So that kind of just summarized all of our objectives. So let's start with our journey. I'm going to be very brief, so we're not going to, this isn't really a case review, but I thought it would be nice to start with a patient that we might see. So patient S is a 2-year-old Hispanic girl. Parents bring her to her pediatrician because they're worried about her speaking. They also share that she has fleeting eye contact, prefers to play with her small dolls by lining them up, and is sensitive to loud noises. Her hearing is normal. So her pediatrician refers her to developmental pediatrics. So this kind of graphic is something that I'll use through the talk to kind of walk through this journey. So we have patient S and her family, and they've now had a referral. So, to get an idea of what the journey would look like and why things go the way they do, is to get an idea of what developmental pediatrics looks like today. The coastal states, so this is the developmental and behavioral pediatric specialists per 100,000 children, and our coastal states certainly are much more populated in the developmental and behavioral pediatric subspecialists. With the darker blue meaning the more per 100,000 children. So as you can see for us in Arizona, we are pretty limited, and many of the other bigger, kind of more rural states are as well. And there are a couple states even surrounding us that do not have any at all. And why this is important, because about 16 to 18% of children in the US have a developmental disability, which really is a broad encompassing term, generally means a child with a community child with autism, intellectual disability, ADHD, learning disability, or other developmental delay. So the patients that are getting referred to see us will have most often have a developmental delay, and this could be a single or it could be global delays, which means two or more delays. Certainly, we get a lot of referrals for autism, for ADHD, for general behavioral concerns without any specific diagnosis. Those that are identified at risk for or have a formal intellectual disability diagnosis. And then certainly we see a lot of genetic conditions associated with developmental disabilities. We have dedicated Down syndrome and Fragile X syndrome clinics, and we see a broad amount of other genetic conditions as well that get referred to us, not for management of the genetic condition, of course, but their developmental and behavioral needs. So getting in to be seen, as you all probably know, and it's not exclusive to developmental pediatrics, but certainly is a big thing in developmental pediatrics, is it takes a long time. So the average wait time was in 2017 was about 5.5 months, but there's a lot data to suggest that those have probably increased since COVID. And then a 2016 report from the National Survey of Children's Health found that 30% of children with autism were not receiving behavioral interventions. So, why does this matter? And certainly, I'm preaching to the choir here, but there is a critical time for development before age 5. The younger we can get them into services, the better. A shout out to the Craniosynostosis conference this past weekend, and it was really nice because everybody across the board for all of the pieces of what gets done for these kiddos was highlighting early intervention. So that is always a theme for what we talk about. Early intervention improves developmental outcomes, school readiness, social skills, and we know that delays in identification and support are really missed opportunities. Okay, so we're back on our journey. And unfortunately, because what we know about the lack of resources to access developmental and behavioral pediatricians, unfortunately, it takes a while to get in to see us. So we have a 7 months wait, and we get in to see the pediatrician. So S is now 2 years, 7 months of age. She got in to see us, yay. She's accompanied by both her parents. And again, very quick summary. We're not going to go into all of the things, but ultimately, she gets diagnosed with autism and speech and language disorder. And then the following recommendations are provided, which is a pretty almost a very often thing, a common thing when families leave developmental and behavioral pediatrics is having quite a few recommendations to follow through on. So start developmental preschool at age 3, apply for DDD in Arizona long-term care, start speech therapy, start occupational therapy, start ABA therapy, and follow up in 4 months. Okay, so now we have all of these things to do. So the top would be the application, speech therapy, occupational therapy, ABA, and then school. So a little bit more about S and her family. They have low health literacy. One family car limits transportation, and there are 2 other children in the household. So care after developmental pediatrics, we know that accessing therapy, school support, state services is a challenge across the board for families who have children with disabilities. This is certainly increased among minoritized groups and those with low socioeconomic status. The lower financial resources has good evidence to show that they have unmet needs and lower quality of care, and the lower odds of receiving early intervention services. Transportation barriers certainly prove to be a problem for a lot of our families. It can be a major obstacle to school attendance and certainly attendance of therapies. Health literacy impacts abilities to navigate information required for services and less likely to identify service needs. So, while this isn't, all of these things aren't the case for all of our families, we certainly have a lot of families that come to us with, if not one, but quite a few of these. And you all know the important work that's being done with the social determinants of health screener, which allows us to know if, without asking up front, what might these be for some of the family that we see. And then other children in the home, there is evidence to show that this leads to lower odds of receiving intervention services, higher parental stress, and lower education level of a family might compound this as well. So parental stress, something that we always need to be mindful of. We know that parents often prioritize their child's need over their own mental health. This occurs for all the children, especially for our children that have special needs or complex medical needs. This leads to emotional exhaustion, decreased capacity to manage appointments and even advocate for their child. Again, this is even more compounded if there's any financial strains. Some parents experience social isolation because of this or because of the child's diagnosis itself. And it certainly is exacerbated by any sleep or behavioral issues of the child, which are very common to occur in the children that we see. Okay, so again, so we have our patient and the parents now need to complete 2 separate applications. They need to identify therapy providers for both speech and occupational therapies, find ABA that would schedule for about 20 hours per week and work with their schedule. Some of those hours can be variable. And then they need to direct the request for school services to the appropriate person to initiate an evaluation. So again, these are all the things that we've asked this family to do. So this is where our Care Navigator, we really wanted to advocate for this. So it's focused on early supports for young children identified with developmental concerns. So the objective is really to have a single point of contact for families. Our interpreter, our Care Navigator is able to utilize interpretation as needed. The hope is to increase engagement between follow-ups and perhaps even reduce the need for more frequent follow-ups. So oftentimes when a child would be seen in developmental pediatrics, and these recommendations would be put into place because of concern for, some of these families falling through the cracks or these limited resources allowing them to follow up on the recommendations that were given. We wanted to see them more frequently to make sure that didn't happen. To improve medical care compliance, paperwork coaching, identifying resources for treatment plans such as school supports and therapy supports, and certainly be proactive to mitigate barriers that may come up for the family. So this is a bit of a busy slide that I'll walk you through, but this is a really nice study that was done in 2022 that looked at the benefit of care navigation slash care coordination in children with um, neuro, sorry, neurodevelopmental disabilities. I'm going to go back. So PICS that you'll see on the slide is Parent Integrated Care Survey. So access to care. So these were caregivers' ability to access needed medical or social services, wait lists, ongoing needed health information, or booking appointments. So at baseline, 79% reported some or a lot of difficulty doing this, and then after care navigation of 12 months, only 30% did. Care goal creation and planning, so creating short-term and long-term care goals, and then sharing these goals across service areas through an integrated care plan. So 50% at baseline reported that their care team worked with them, and then it was up to 70%. With team functioning and connectivity, so health providers having access to same medical records and awareness of plans and information sharing. So 29% reported a positive response rate to care team functioning, which was up to 75% at 12 months. And then I'm going to skip over to access to community resources. So family or caregivers' ability to access community services, programs, and resources. So 31% reported moderate to high access to community resources. And after 12 months, 73% reported high access. And then you can see the same with navigating school services. So at baseline, 12% reported help, up to 62% reported help. So really a profound impact for these families with children with neurodevelopmental disabilities. And then with regards to parental stress, I mean, I think it kind of goes without saying based on the previous slide that it probably mitigated a lot of that. But a 2016 article really highlighted that care navigation reduces caregiver stress, it improves access to services, and it reduces that high burden of care management on families, which was really helpful. So this is for developmental peds. So I'm going to go back to this. So in March 2025, this past March, well, February, March, I'll say, we onboarded and hired our care navigator, Amanda Rush, who is amazing into developmental pediatrics. So as of March, we have over 100 enrolled with a 70% enrollment rate from referral and over 30 graduates. So you can see over time just how many people are being touched and impacted by Amanda, our care navigator. And over 250 goals have been completed to date. So we have quite a few goals that Amanda has with the parents and families that she interacts with. So she connects them with therapy clinics, referrals faxed, on wait lists, getting them into places that are convenient for them, will meet their needs, and families have reported being very satisfied and excited for that. Whereas previously, we probably would have had families that would tell us that they're still finding places or haven't yet identified a place that works for them. Provide resources relevant to diagnosis, applying for DDD, that's huge for us. And just having a touch point for those resources is really impactful for families. We've had a lot of families that from the first appointment to the second appointment, anecdotally, I would say a lot more have reported that even just being in the process or having been approved for DDD and all text has gone up significantly. Follow-up appointments being booked, resources for a patient portal, which is really important for communication, of course, and other goals as well. So, again, this is not a real life patient, but this happens quite often. Is now we have a patient who's qualified for DDD and long-term care, has upcoming evals for in-home speech and OT, ABA provider identified with transportation from school and close to home, and starting school at age 3 with transportation to and from. So the bottom line is the children we serve have high care navigation needs, especially those with lower socioeconomic status and minoritized families. Care navigation, we know with good evidence, improves timely access to care and overall experience. And our Care Navigator program is a high equity, high impact intervention with some really nice measurable outcomes. So thanks to Vanguard for supporting our hopes to get a care navigator, Amanda Rush, who is our absolutely incredible care navigator, and Faye O'Hanlon, our amazing practice manager, who provided me some of our slides to highlight the work that she's been doing and has been instrumental to making this care navigation program a success. Stop for questions. I'll stop sharing. I know that was brief earlier morning, but I kind of whizzed through that.
Hi, my name is Vanessa. I just had a few questions for the in regards to the care navigator. So the care
Yeah.
navigator is really the one that's talking to like the nurses, the doctors, really kind of gathering all the information to better assist not only the patient but the family and whatever the treatment recommendations are and finding those services for the patient and the client, correct?
Yeah, so I can talk a little bit through the what happened. So family is identified by one of our providers for being from benefiting from care navigation services, and a referral gets made. We certainly have access to our end of visit summaries and our recommendations, and in our net referral to her, we would write, what specifically we want families to have access to, and then she reaches out to family, identifies their needs. Sometimes these needs change after the visit from the provider. And she would either, connect them with the therapy services, identify ones in their area that may benefit them, support them with the DDD application. We've also created a streamlined approach for kids that are getting an autism diagnosis in developmental peds who we've identified kind of overall or higher needs because of the amount of resources and recommendations. And she meets with them. We kind of consolidate a few of these on a half day, and she meets with them in the clinic to kind of provide that warm touch base and talk about the next steps. And then she would communicate with them as needed until the needs are met and the goals are met, and then they would graduate.
Thank you. And then will the slide deck or like the information, like the statistics you put out, would they be available to us?
So yeah, so this is being recorded, so I believe that you would have access to the recording, and I can send out the slides as well. I can send them to Christina and Dr. Lewis.
Thank you.
Go. Anyone have any questions?
Hi, Dannah. That was great. I really enjoyed that. Question sort of about the care navigators in terms of who they are and how you sort of find them in terms of um, their roles and their responsibilities. I know sometimes we use social workers to do part of this, but that's not enough to get to what we need. Sometimes we use our nurses and our MAs to talk to the families and get this there. I like this idea of having one person who really does all this thing. So their training level. Can you kind of explain a little bit to that? And also whether there's sort of the idea that this is very specific. Yours, I think, is very specific for developmental pediatrics. But I think
Hmm.
certainly in other fields, you could have even some people who do some similar fields,
Yeah,
neurology and neurosurgery or things like that, where they really have patients who are identified for this.
yeah, absolutely. I mean, I think care navigation, would be great in many pediatric specialties for sure. There's no standard for which, certain degrees or training exist. We had our job posting for our requirements, and Faye, our practice manager, met and found our amazing care navigator who actually has had I don't know if she's on this call, but she's had previous to working with us quite a few years, many years of care navigation experience. So we were really fortunate to find her. She had a lot of experience in the world of care navigation for kids with neurodevelopmental disabilities. I see Faye's adding in. She brings prior experience as a care coordinator, behavioral specialist, and early childhood interventionist. So the end of it is that there's no specific like training that exists or like certification, that we have like for our medical assistants and things like that. But for us, we were really fortunate to find such a care navigator with such valuable experiences that really allowed us to really start off her work here really quickly.
Dannah, it's Katie. Thank you so much. That was awesome. How did you guys justify the position? Because I think that that's always been a big struggle is justifying, having a social worker even, but
Mhm.
having like a care manager, was that an easier sell? Is it like a level that you could maybe bring somebody in and then add like a second? I'm just curious because we all know it's hard to get positions approved.
Yeah, so this one is supported by Vanguard right now. So it's not it's not a position currently that is salary through Phoenix Children's, I guess is a great way to say it. And Faye, I know I see you're up here, so jump in whenever. The goal is to demonstrate the grant funded rather than operational budget. Thank you for the correct wording. Um, and the goal is to really, demonstrate the benefit of it. It's, we'll have to see kind of how things move once the grant is finished. But it's been such a successful program. We know that we could have more Amandas in our clinic for sure. So the short answer is currently we're grant funded. And the operational piece, hopefully we'll be able to advocate for down the road.
Dannah, it's Brenda.
Mhm.
While patients are waiting to get from me to Dev Peds, can Amanda help them navigate that road of DDD and Altex? Because sometimes I see kids who are already diagnosed with autism, they just haven't done anything. And so I'm trying to get them started on that process, but could I refer them to Amanda and she can help them with, here's your check boxes, here's what you got to do.
So yeah, so currently just because of her capacity, it's internal referrals, but certainly if it's a child with autism, we can see them in developmental peds and then we can get them plugged in with Amanda to do that. And she does, help them, with the coaching through the DDD and long-term care process, and if needed, plug them into places that can, provide elbow-to-elbow support in that application as well. So that's kind of where we're at right now. Um, Obviously, if we have so many more, we could do more. But right now, with her capacity, we want to be mindful of that and have her be able to see the families in Dev Peds. And yes, Dr. Williams and Circle Families, formerly Raising Special Kids, can also help with that. There's quite a few other organizations that help with DDD long-term care application, like Care for the Caregivers as well. And I believe Branching Out Families do a lot of great support for them too. Um, and then I see a question of relocated back from Massachusetts and developmental pediatrician reports weren't always accepted by DDD. Um, so so being accepted, so for currently for DDD, I would say generally they accept reports from developmental and behavioral pediatrics. What DDD really, they require appropriate documentation. So they understand that, not all children need an ADOS report when they're seen by a developmental behavioral pediatrician. So for the most part, if the documentation is done appropriately and demonstrated why the child meets the diagnosis that they're receiving, for the most part, DDD has been helpful in accepting those. I haven't, as of lately, received much pushback for that. And actually, we have a program here called Early Access to Care Arizona, which is a formalized training program in coordination with DDD to train general pediatricians in Arizona to diagnose autism specifically. And DDD, we kind of get these pediatricians certified, and then DDD accepts their diagnosis, and we train them how to provide the appropriate documentation that DDD needs as well. So I think we're making strides here on that realm. Certainly, a lot more advocacy to be done. But for the most part, to answer that question, it has been an issue, but I don't believe it's as significant as an issue as it used to be for DDD specifically. And Amanda, she certainly helps to bridge the gap, right? Sometimes we have families that say, insurance needs to see X, Y, or Z, and she um, communicates very readily with our providers on, what they need to have, what the referral needs to look like, so that the child can receive the supports they need as soon as possible. Yes, we're very glad to hear DDD is on board. Thank you. All right. Any other questions, thoughts?
Just another question or maybe thought when the obviously like for this particular, this patient we had, she does have Hispanic backgrounds. Now, let's say the parents are, for example, undocumented and obviously maybe they only qualify in regards to like their coverage. It could be maybe emergency access or something like that. Now, the child is born here and obviously they may benefit from more things because they are a citizen. Does this do they typically just look at what the child is carrying, or is it a combination or collective of like both family and child and what they're going to be able to afford that covers their insurance, or what does that look like for them?
So yeah, that's a good question. I don't believe I think if the child has citizenship, is born here, I don't, as far as understand, and I could be wrong, so I'll speak carefully about that. I don't believe that that becomes a problem for DDD long-term care. DDD long-term care is not um, it's not a financial based resource. So it's not based on a parent's finances. It's based on the child's diagnosis and their functional limitations. So that does need to be documented by the provider for them to be able to access that. And then the Arizona Long-Term Care, that's secondary insurance. They then do their own kind of medical, quote unquote, medical evaluation as well to determine ability to receive their services. So um, if anyone wants to jump in on that, I believe as long as the child has citizenship and documented, or not citizenship, but is documented, they should be able to receive that.
Thank you.
Well, thank you for all the great questions. We're really proud of this program and what it's been doing for families. We certainly know the reach could go really, really far, and hopefully, we can advocate more and more for care navigators across divisions. But I really want to shout out to Amanda. She's been just so phenomenal and such a great resource for families. So we're really lucky and excited to have her. And thanks so much for listening today.
Thank you, Dr. Rouse.
Thank you.